Duran here on the Q96.5 FM, 8 minutes after the hour of 10 o'clock, and we're into the medical hour, as we always do at this time of the week. Brought to you by the medical specialty clinics of the Bryan Hospital and community health professionals. And we have the boss with us today, man, Phil Ennin, and it's always great having Phil around. Phil,
I'm back.
Yeah, man, I'll tell you what, we open up the year. Last week, you're going to have a hard set of shoes to fill, though, okay? Because we talked hypnotism last week, okay?
Oh, yeah, that's cool, isn't it?
Yeah,
I've learned a lot about that.
Yeah.
It's an amazing old tool that's kind of new again. And we've had tremendous success with people in terms of the hypnotism. It's not skull and crossbones stuff. It actually makes sense. What I've learned more than anything else, and I assume you had Mike out here,
right?
Yeah. So Mike Freeman has shared with me and taught me that the key really is more than anything else is that the patient really needs to be amenable to the idea. Mm-hmm. Yes. So if they have a mindset that is open to hypnosis, it'll work. If they have a mindset that's not, it ain't going to work. Yeah. So we're really pleased that Mike brought that idea to us several years ago, and then we helped him to get the certification and sees a lot of patients.
It was intriguing to me because I've always been that guy, Phil, that says, nah, you can't do that to me.
Right.
I can't be hypnotized. There's no way in the world. And that's what he said. Well, then you can't be hypnotized.
Yeah.
And I'm like, okay, well, now you got me.
Well, that's the one thing that has always been great. Mike Freeman's been with us for a long time. He's been a therapist in the region, in the area for a long time. We were really fortunate when we picked him up from Fulton County Health Center a long time ago. And the thing that I love about Mike more than anything else is that he speaks truth. So if you're into it and you're into the counseling and he thinks you're making progress, he's going to want to work with you. If he thinks basically it ain't working, he's going to say so.
Yeah.
Which I think is great in a counseling, because sometimes you feel like you get into a counseling situation and you kind of wonder if the counselor's really making progress with you or just cashing the check, right?
Oh,
in Mike's case, I've never felt that. Yeah. So he does great work.
Oh, he was a lot of fun last week, and we talked about some of his normal jobs and routine and the things that he did, and then that took about 2 minutes, and then we were into hypnotism.
Yeah, hypnotism. Yeah, absolutely. Yeah,
and it went easily. An hour went by so quick; it was unbelievable.
Yep.
So what's new at the hospital nowadays? Anything that's coming up for the new year? We've turned the calendar. We're in 2018 now since we saw you.
Well, the new things coming in our direction in the near future is that we opened this women's health clinic last fall with Dr. Hanan Bazzi, and her partner will be arriving in April.
Wow.
Dr. Summer Hassaneh.
Okay.
Also a University of Michigan trained physician, which some people listening will grimace. But I think their medical school does a nice job training people.
They do.
And so I think that's okay. You may have to put up with a couple of signs or pictures in the office, but other than that, they know what they're doing, every bit as well as anybody who comes from Ohio State. So she has been working at the University of Michigan hospitals for, I think, about 5 to 6 years, if I remember reading her resume correctly. And she and her husband looking for a new opportunity and a new experience. Knew Dr. Bazzi. Dr. Bazzi knew her. Okay. And started a conversation that went really well, really fast. So she and her husband will, I think, arrive in March with their young child. Kind of a perfect family for this kind of community. Sure. Young couple, young child.
Yes.
And then we'll be arriving right when Dr. Bazzi would probably be telling me, boy, I really could use a partner because she's getting busy.
Yeah.
So Dr. Hassaneh will start in April. Her husband actually start working with us in March. He's an infection control professional. It'd be nice to have that kind of talent with us, especially in the season that we're in right now with the flu and prevention of infection. So that's the thing that's going to happen the soonest in terms of that. Then once we get Dr. Hassaneh launched, then we'll pivot and start working on this brand new clinic that we'll have open in September, a gastroenterology clinic. First of its kind on a full-time basis in Bryan, at least as well as I can remember. Now, there's plenty of people in Bryan who go way back further than me and will probably correct me at some point later this week.
Sure.
But Dr. Matt Cooley, gastroenterologist, wonderful story. Grew up in the Detroit metropolitan area. His dad was a doc in the Southfield, Michigan area. When he decided to go to college, decided to go to Miami of Ohio. Good school.
Yep. Great school.
First day on campus, meets a girl.
Okay.
They're married. I think for those of you who out there who are Miami of Ohio grads, that's called a Miami merger. I believe that's a real thing.
Wow. Okay.
A Miami merger. She's from Cincinnati. So then he goes off to train at Ohio State. He goes to Ohio State for medical school. Then he's off doing his residency. And when they're thinking about where they want to live, they're trying to find, maybe we could find a place that's sort of like halfway to Cincinnati and kind of halfway to Detroit because, I like your family, but I don't know that I want to live near them. And I like your family, but I don't know that I want to live near them.
We have the same feelings we all have.
Yeah, so
no doubt, right.
Lo and behold, if you kind of look at a map and you don't pay attention to how the roads work, Bryan looks like it's halfway between, right?
Okay.
Pretty easy to get to Detroit, kind of painful to get to Cincinnati from Bryan.
Yes.
At least the first hour or so kind of thing. Ain't like the old days when you could just drive 127 down. That's kind of a painful drive.
That would have been a major painful.
Some beautiful county seats.
Yeah, exactly.
Probably sooner or later they'll end up doing it. But so Matt and Kelly will move here in the summer. He'll open his practice at the Bryan Hospital Gastroenterology Clinic in September, and we're going to be doing a lot of promotional work leading up to that because this is new and different. To have a gastroenterologist available. We've gotten a lot of really positive feedback from the local doctors that they would love to have that resource available to them. They have a lot of patients that they would like to send to a gastroenterologist. It's really hard to get in Toledo or in Fort Wayne or Ann Arbor or wherever you go. So this will create this opportunity to have something local. And then the other thing that we'll do is this is a particular clinic that actually will draw on a regional basis. So once he's known, we'll be pulling people in from Defiance, Van Wert, Southern Michigan, because it's just hard to get in. So when they find out, well, you can go see a gastroenterologist, but he's in Bryan, then I think what they're going to say is, well, he's a gastroenterologist, right? Well, yeah, right. Oh, well, I know where Bryan is. I can find it.
It's not that hard to get to. Yeah, no doubt.
Because we've seen that a little bit already with the Women's Health Clinic. We've seen the Women's Health Clinic have a broader reach than we typically have had in the past. Yeah, so we've got plenty of stuff to kind of keep us busy between now and September. New clinics, clinics that are growing.
Yeah, sounds wonderful, and that's exactly what we need right here in Bryan. Is this something that at this point in time we're seeing more and more of? I mean, smaller towns attracting these types of specialists, and that's the future for us. You think? I mean,
I think the answer to that really is actually no.
Okay.
It's hard.
Sure.
It's we have to be honest about where we live, right? We are not living in the most attractive part of the country.
Sure.
We don't have a beautiful, massive lake, which is 45 minutes away. There's lots of lakes 45 minutes away, but not necessarily here.
Right.
We don't have the mountain that we see outside our windows. We don't have the ski resort close by. We don't have whatever we don't have.
The major city with all its allure.
We're not sitting on the outskirts of
Hartford,
Hartford, Connecticut, things like that. So we don't have the major airport, easy drive.
Right.
So we're in Bryan in Northwest Ohio. Yeah. So the number of individuals who have the training that want to live in a community like ours is a pretty small group. And so then since they're pretty small, you got to find them. Right. So, Dr. Matt Cooley works because he grew up in Michigan. He gets it. And his wife grew up in Ohio. She gets it. I think if I had tried to recruit him and he grew up in Virginia and she grew up in South Carolina, I don't think they're coming.
Right.
So it's hard. The second thing, and so when you see situations like this happen, first of all, what you see is you probably see a hospital in a rural community that is actually still independent. Because the big healthcare systems, if they're going to recruit a gastroenterologist, they're going to recruit a gastroenterologist for their main location. And then they're going to maybe send a gastroenterologist out to a community like Bryan for one day a week or one day every other week, but not full time.
Sure.
And then what they're going to do is they say, well, those people will just drive in to see us, which is true. So so unless you're kind of local, then you don't have the same sense of urgency to solve the problem for the other town that you're not in. And so, I would have to say that if I'm a leader with the ProMedica healthcare system in Toledo or the Mercy healthcare system in Toledo, or if I'm on the board there, then I'm selfish and local about Toledo.
Sure.
So, take care of where I live first. I get it.
Yeah.
Same thing out here. We have a board of directors that's selfish and local to Bryan and Williams County.
Sure.
Take care of us first.
You bet.
So, and then the other thing is that sometimes even if you want to do it, there's just nobody available to pick up. There are other specialties that we would love to have here locally, but we just can't make it work.
Yeah,
can't
right.
find those candidates.
Are we producing enough doctors and specialists like this nowadays? I mean, there was a question about that.
Well, it depends on what you think they should be doing, what the job description looks like. Okay. I would argue that if we took a look at primary care and we took a look at who's providing primary care, and I'm talking about not just primary care in a family medicine office, but even primary care in a specialty office, because you can have a urology clinic, but there's specialty work within that urology clinic, and there's primary care work within that urology, the basics, the nuts and bolts of urology care.
Sure.
And I think as a nation, what we have to expect is that there's a group of individuals who are well trained to do this, but they're not full-blown medical doctors and naturopathic doctors and osteopathic doctors. They're nurse practitioners, physician's assistants. So the job descriptions need to change a little bit, and there needs to be created this opportunity for these practitioners that aren't full-blown physicians but are trained really, really well. And then when you have physicians who are fully trained, they're going to have to really focus on, okay, I've got all this additional education, so this is the group of patients that are a little bit more sick, a little bit more complicated. Then the strata of the healthcare supply can come closer to meeting the demand. Won't mean that it will totally come to that, because the other problem is a lot of the demand that we generate on the healthcare system is because we don't eat well, we don't live well, we're not worried about our nutrition, we don't exercise enough, so we end up in the doctor's offices for things that if we just kind of took care of ourselves better, we wouldn't have ended up there.
Yeah. Sounds like we're almost taking a step backwards. When I was younger, when my parents were younger, there were a number of nurse practitioners or midwives, or that was a commonplace to have this happen that way. Then we got away from that, and everybody had to be a doctor, and we all had to go to a fancy office, and we all had to go to a wonderful hotel that we call a hospital, and then we are to this point where we're stepping backwards here. It almost looks for the good. I mean, I don't think it's a negative necessarily.
I think in a lot of areas, what we're finding out is that there was a lot of common sense that existed, in the 40s and 50s and 60s that got set aside. Mostly because we had this massive baby boom, and all these people who went off to college and came out and had degrees and wanted to work, and and then that tide flows through us, and now those boomers aren't necessarily working, they're just aging, and now they need care. But the number of individuals kind of in the waves behind them aren't nearly as many. So, the tide of that boomer tide, on the back end of the tide, is kind of hard to figure out how to meet all of their needs. Living a lot longer. Living, I think, trying to live healthier. But even if they're not necessarily living healthier, we got some amazing ways to sort of keep them going.
That's the other side. Yes.
So the fall off isn't there, right? Sort of the everybody's lasting longer than they've ever lasted before. I lost my father when he was 73. Right. 73 nowadays would be, wow, that's young. Right.
That's
when he passed away, 73. Now we have people very, very regularly walking to the hospital for care who are north of 95, heading towards 100. And quite honestly, they're doing better than me. I think they're walking better than me, they're thinking better than me, they're talking better than me, they're smarter than me.
It's amazing, isn't it?
But to have a 103 or 104-year-old walk into the hospital 30 years ago was it was like everybody stopped and looked.
There's no doubt. It is amazing. Phil Ennin is our guest right now, 23 minutes after the hour. I need to pay a couple bills right now, so let's step away. We are in the medical hour here on a Wednesday, all brought to you by the medical specialty clinics of the Bryan Hospital and the community health professionals. And we'll be chatting all the way up until 11 o'clock here this morning. Okay, so we'll chat about that here.
Yeah, that's fine. Oh, sure. Absolutely.
Phil Ennon back with us here on the Medical Hour here on a Wednesday, and all brought to you by the Medical Specialty Clinics of the Bryan Hospital and Community Health Professionals. Phil, let's talk about where we are right now with this flu situation that we've had around Northwest Ohio. It's been nasty.
It sure has.
Yeah.
It kind of reminds us that as much as we think we're in control, we're really not.
Yes, yes.
So it's been difficult because the vaccine that was made available to all of us wasn't necessarily well organized for what eventually showed up to make us sick.
Okay.
So it's not as effective as past vaccines have been. Now, I don't really fault the scientists for that. I actually think it's kind of miraculous that they can guess what the bug's going to be like and do so well at the guessing through the years. But this year, if you had the vaccine, it's still a way better option for you to have had the shot than have not had the shot. But if you did have the vaccine, it doesn't cover as well as past vaccines have. What frustrates, I think, my world, the healthcare world, more than anything else when we get into situations like this, is that people don't understand or aren't willing to take the time to protect themselves like they should.
Right.
And it's pretty basic stuff. It's the offensive line of healthcare. It's blocking and tackling. It's washing your hands, keeping your surfaces clean, keeping your work surfaces clean, keeping your home work surfaces clean, realizing that you're in a situation where a lot of people are around and we don't know where they've been. I was kind of had an interesting conversation traveling over the weekend, sitting at a table. We all grab our menus, right? And then one of the people at the table says, well, the single biggest sort of carrier of the illness in a restaurant is the menu itself. So I'm setting the menu back down, pulling out the wipes. And so...
Do you travel with wipes in the pocket there all the time right at this point in time?
I don't necessarily travel with wipes in the pocket.
Okay.
My wife has a wonderful routine that she's done for quite some time now, that when we get to the hotel room,
right,
she's wiping everything down.
Okay. Yep.
And it doesn't take very long. It's not very hard.
Yep.
No offense against the hotel, just making sure.
No, just double checking. That's right.
So I just think that if people took a little bit more time to make sure that they were keeping themselves as bug-free as possible, overdoing the hand washing, using the hand sanitizer, there's a chance that they wouldn't get sick or they wouldn't give the sickness to somebody else. We recently it got so hectic with us that we put the restrictions in place. We asked people to stay away.
Sure.
It's kind of funny when you do that, Jim. We ask people to stay away, and it seems like more people show up. It's almost like, well, they're not going to tell me what to do. So we would have families coming in wanting to visit ill ones and coming in clearly sick themselves or clearly healthy. And then when we step forward and say, look, we're trying to kind of keep everybody safe here, we really had some families get really irritated with us.
Isn't that amazing?
You're not going to tell me I can't see Grandma.
Wow.
And when we say, we're not saying you can't see Grandma because you just kind of wait.
Sure.
And so, but I mean, those were the exceptions. They weren't the rule. I mean, most people going, okay, yeah, I understand.
Yeah.
But every once in a while you just run across people and say, look, we didn't do this to really inconvenience you. We did this. In some cases, I almost wonder, like, they really weren't planning on visiting the loved one in the hospital anyways, but then when we said there are restrictions, they decided to come.
Isn't that's human? That's human.
It's human nature. We have a wonderful lady who, ever since we opened the new hospital, has come almost every Tuesday evening and played piano in the dining room for the guests. To the point where if she doesn't come, the guests are like, where is she? And there are people who come eat on Tuesday nights at the hospital because she's there playing. And she called me and said, well, I saw the restrictions are in place. What do you think I should do? And she said, I already stayed away one Tuesday. I said, well, that's what I think you should do. You're feeling good, right? You're not sick.
Right.
Why do you want to come in and risk it, right?
Sure.
The sickest place in town. And she goes, well, I understand what you're saying to me, but I got people who, they come because I'm there and then I'm not there. And I said, well, they kind of shouldn't be coming either.
Yeah.
Yeah. So it's been really, really interesting for us to try to educate the public on why we put the restrictions in place. Selfishly, we kind of put them in place to kind of protect our own staff too.
Sure. How do you keep a staff? How do you honestly keep people who are there, and that is their business, their job, every day, working with sick people, healthy?
Isn't it amazing?
Yeah, when
did you think? I mean, I have no science behind what I'm about to say, but I do say that there's this thing about working in healthcare that kind of goes around that basically says, for some of us, the first year or so that we work in a healthcare institution, we get sick a lot.
Sure.
And then after a while, it seems like we've built up immunities because we're kind of around it more often. There's no science behind what I just said, so all the science people out there, relax. I don't know what I'm talking about.
But it seems to work. It does seem to happen that way.
At the same time, though, the issue with the staff is they do get sick.
Right.
And sometimes it's not necessarily they get sick in the hospital. They're trying to raise families. They're going places, doing things. What they work hard at more than anything else is not getting everybody else sick. Right. So, okay, I'm down. Every once in a while, you have a warrior. Everybody in a workplace has the warrior who has never missed. Right. And you're kind of looking at, well, since you decided not to miss last week, now I'm home because you brought all the yuck in with you.
Yeah, exactly.
But I think amongst our staff, what we've seen is a real desire to keep each other safe, and they've done a great job this year. When we go back and look at it, and I haven't looked at it yet, I don't know. I mean, I'm certainly going to see that we probably had a spike in the use of sick time.
Sure.
But I can't name an employer who didn't.
Oh, yeah.
But I don't know that it's going to be an inordinate spike. So I'm really proud of them because it's not easy to try to stay clean all the time. It's just not easy. And their skin can get really chafed and dry and irritated. The hand wash. Think about washing your hands and using sanitizer 10, 11, 12 times or maybe 50 times in an 8-hour period. Your hands get
they'd be
roughed
dry.
up.
Oh gosh, it wouldn't be good at all.
So I'm really proud of them because it's not easy, and I think they've done a great job with it. And I think the thing that they really worry about more than anything else is the person that I really don't want to get sick or get any more sick is actually the patient. I don't want to give something to them.
No doubt.
Which I really like.
Yeah, you were telling me off mic that really the flu wasn't the only thing these people are fighting this year. That a lot of folks got very sick thinking they had the flu, but it really wasn't the flu.
I had my family doctor several years ago before he retired, and I kind of hope I wasn't the cause of his retirement. But he shared with me that the people use that phrase "flu" very, very broadly. And I said, well, so how many people really have the flu? And he goes, all I can tell you is that when you finally have the flu, you'll know the difference.
Okay. And
up until then, you've had gastrointestinal upset and you've had bugs, but you haven't had the flu. And I said, well, what do you mean? He goes, because it will lay you out.
Yeah. So,
okay, I understand. So people who, I think the one that's been the most interesting to me in this particular season is people who encounter a situation where they have a fever and pretty heavy-duty aches, not necessarily nausea, and it just knocks them down for a couple of days.
Right.
I don't know that that's flu.
Okay.
But it's an ugly bug.
Yeah, it was an ugly bug. I had that. Yeah. I had exactly that. Yes.
And but if you want to call it the flu, that's fine with me. And then after a while, the doctor's offices and the hospitals get so overwhelmed that rather than do the testing, because it's so prevalent in the community, there's an assumption that flu's going on, and you get the medications associated with that. And there's some nice over-the-counter stuff that you can get in the drugstores to help you at least cope with the symptoms of the whole thing. I don't know that they necessarily shorten things, but you cope with the symptoms. And I built some familiarity with that because my two daughters who lived together in an apartment in New York City managed to be both sick at the same time. It used to be one of them got sick, the other one could go get things.
Yeah.
Luckily, they stocked up before they both got laid low. But I don't blame people for calling it the flu because that's what's going around, and I'm really pleased that we don't have as much true flu as people think we do, because then we'd have a lot more people getting sick and unfortunately a lot more people dying.
Right.
People still do die from the flu by the thousands every year.
Yeah.
Usually it's not really the flu that causes it. It's just sometimes they just have some other medical condition and then they get the flu and that they can't cope. So I hope it's over. I hope it's over soon. And maybe, with the getting into February, getting into March, maybe it will. It's just there's these times of year that are always pretty interesting. Flu season is one of the interesting times of year. Another time of year that's interesting from a medical perspective is when school starts. Sure. And when school starts again, because it seems like the kids all go to school, they infect each other, and they go home, and all the families get sick for about a 2 to 3 week period at the beginning of the school year. We'll have this happen again. We probably had a version of it happen again after school started up in January.
Right, after the Christmas break.
We'll have it after spring break.
Sure.
So it doesn't mean they all end up in the hospital. It just means that we have employees who can't come in because they got sick kids.
Yeah.
But it's just the cycles that we go through as human beings because we're really good at sharing everything with each other, the good and the bad.
Yeah, we always are. There's especially the bad. There's no doubt about that.
Yep.
And we had people die locally here from the flu?
I'm aware of one individual, a Williams County resident, who did pass away. It started out with us.
Right.
And became quite ill and was transferred on, and then from there I think passed.
Right.
Now I have not, I haven't looked at the more recent reports on the whole situation. Hopefully that is the one and only.
Yeah.
If not, we'll hear. I'm sure I'll get a report on it here at some point. The public health folks here are really good at reporting and tracking. They do a great job.
Yeah, they really do. Phil Ennen's our guest right now. Time for us to step away for news and a couple commercials. When we come back, there's other things I want to talk about. I want to see how things are going right now since we have taken the federal mandate off the insurance program that was called Obamacare, and some other things that are crossing my mind right now that we've not even gotten close to. It's 23 minutes right now before the hour of 11 o'clock. Phil and back with me here on the Medical Hour, brought to you the medical specialty clinics of the Bryan Hospital and also the community health professionals. All right, Phil, we have now turned the corner. We're in 2018. The Republicans, along with our president, have at least gotten past the idea of this mandate that was part of our insurance,
right?
That they like to call Obamacare all the time. What have you seen so far? I mean, I know it's quick.
It's very early,
been,
yeah.
A couple months at this point in time, but their prediction was as soon as they take that away, there will be several million people that will cancel their policies and now be without insurance. Are there any trends like that you're seeing from your side?
I never really felt like there were a lot of people out there who were really buying the policy because the law said so. I never felt that. Mm-hmm. I still think they made an economic decision and a personal decision. So the economic decision was, if you're only looking at the economics of the thing, how much is it going to cost me to have the healthcare policy, and how much is it going to cost me to pay the penalty to the IRS?
Sure.
And I think a lot of people just said, well, economically, I'll pay the penalty.
I'll pay the penalty. Heck yeah.
And I don't blame them. I mean, it's just it's finance, right?
Right.
And if you're only making 13, 14, 15 bucks an hour,
sure,
that's not a hard decision to make. So then there were the personal decisions, like maybe they actually did have health-related issues and knew they needed coverage. Mm-hmm. So that's the group that took advantage of the mandate and found coverage. The problem was it just wasn't nearly as many people as the government was hoping would sign up. A lot of people did, but
sure.
The government really needed a lot more people, especially young people, to sign up, and it wasn't happening. And I think that's because of the economics. When you're between 20 and 30, you feel pretty indestructible.
Yes, heck yeah.
And if you're between 20 and 30, and in the economy that we're in, maybe you have a full-time job, maybe you don't. Maybe you're stringing together two part-time jobs, make a full-time job. Neither of the part-time jobs is offering you benefits.
Sure.
So you're scraping together somewhere between $28,000 and $33,000 a year.
Right.
And then you look at that premium and you go, no,
I can't afford that. Yeah.
So the repeal of the mandate, I didn't see that as the big watershed moment of the whole thing. I think we were being pretty dishonest about the whole thing. I think the Supreme Court sort of kind of manufactured an outcome when it was challenged in the first place, and then on the 5-4 decision that said, well, because it wasn't supposed to be a tax. Right. Well, it really was a tax, but we're just going to kind of ignore that. And so I don't think that the healthcare insurers themselves have had any kind of an opportunity to form products. We've seen a little bit of a comeback of what were called the slim products, mm-hmm. where you were a couple, you were beyond the point where you were going to have children, and so in the old days you could actually buy a healthcare policy with no obstetrics coverage.
Right.
The mandate took that away.
Right.
Now you're starting to see those policies sort of reappear. Customized, I only buy this, I don't buy that kind of thing. I think that's great as long as you don't accidentally get pregnant.
Yeah, exactly.
But if you do accidentally get pregnant, then a hospital like mine gets pretty frustrated because you got coverage for everything except that.
Yeah, exactly. Yeah. We better start digging. How do those tonsils look right now?
Yeah, exactly. So the more bigger thing for me in terms of what the Congress has been doing or not doing in terms of the healthcare issues is it took them a tremendously long time to renew the Children's Health Insurance Program, which was just wrong. Mm-hmm. Both parties wanted to do it. I didn't really understand why that had to work out the way it did. There are lots of kids in Northwest Ohio covered under CHIP.
Yes.
And would we like to have a different way to provide health care for these young children? Yes, but we don't. We have CHIP.
Right.
So that was frustrating. And I'm pleased with the 6-year extension. At least it gets it off the table for a while.
Yeah.
But then, in addition to that, they did not take care of a funding problem for these really important community health centers that pop up in areas of the country that really can't support a doctor's office and clinic, mm-hmm. but have people living there who need health care. Those people are still not being funded. And then, really incredibly selfishly for me, in my hospital, they've done nothing in terms of the extenders fundings that we still don't have. The low-volume adjustment monies, the Medicare dependent hospital monies, which for CHWC is $2.3 million that we don't have.
Okay.
And what I hear from any office I talk to, Congressman Latta, Senator Portman, Senator Brown, we want to do it. We agree it needs to be done, But the leadership in Congress, the people who pull the strings, they don't want to do it now. So, well, when do you think they're going to do it? Well, when in November I was told December, right?
Right.
In December
right.
I was told January.
Right.
In January unfortunately in January I was told March.
We jumped a month.
So I was kind of like, what happened to February?
Right.
But it's hard. It's just really, really frustrating that they can't do the basics. And I won't disagree with anybody who tells me that we spend too much money and it's too expensive and this and that. Yeah, but I've got to live in it right now. Mm-hmm. And I've got employees who kind of want to get paid right now and would like to have a wage increase right now. I think most people feel that way.
Right.
I don't think that's
It's
an
just
unreasonable thought.
Nope.
Costs have gone up type thing. And we just haven't been able to do the wage increases that we wanted to do in January. We did some of them, but we didn't do all of them. Mm-hmm. And so it's difficult to feel good about the government helping us out. Now, Senator Brown, who's been tried very hard to help us, he actually put a motion on the Senate floor. He asked for unanimous consent to do the low volume adjustment, to do the Medicare dependent hospital, to do the children's program, and then the majority leader, Mr. McConnell, objected.
Yeah,
it died. He actually talked about our hospital. Senator Brown specifically talked about our hospital in his Senate speech.
I'll be darned.
So we're in the congressional record.
There you go.
But he's a Democrat, right? Mm-hmm. And the Republicans kind of controlling everything.
Yeah.
So, but when I talked to Mr. Latta's office, Mr. Latta's staff's been wonderful. They get good information for me. They do good research. It's just they tell me what I don't want to hear, right?
Yeah,
Which is we understand where you're coming from and we completely support it, but it's not moving. So, those parts of the healthcare issues that they're dealing with beyond the insurance side are really, really frustrating right now, and probably will stay really, really frustrating for quite some time to come. I don't think we're going to rotate out of this kind of maelstrom that we're in for quite some time.
The amazing thing, and I watched the entire State of the Union last night, and
wow,
I also watched the rebuttal. Okay.
Wow.
Yeah. How's that for a deal? My wife was looking at me like, "What's wrong with you?"
They could pack you guys into one small room. Who did that?
There's not many of us.
Congratulations.
That's right.
Yeah.
Well, but the amazing thing. Mm-hmm. And again, I saw the fact checking this morning, and we all know that we've got a president at this point in time who won't stick to the facts.
He's got his own version of events.
He does. There's just no doubt about that.
Yeah.
He is a salesman in the worst sense of the word in a lot of ways. He will tell you whatever the heck goes through his brain at that point in time.
Yeah, that's true.
Fact or fiction.
What's that old phrase? Continuous stream of thought.
Yeah.
Yeah.
Okay. That's him. He'll go. But then I was amazed if you were to outline his speech and outline Joe Kennedy's speech, they pretty much hit every one of the same topics with the same idea.
That's true.
We all agree. We want to take care of the dreamers. We want to take care of the kids that need the health care. We want to do this. We want to do that. We want to do this. We want to do that. And the reason we're not is because it's all your fault. And then they point across the aisle.
They sure do.
And it's getting so frustrating anymore for, I think, the average person that walks the streets to have to deal with this. Because, again, there are major differences in some areas, but there are major similarities. So agree to the similarities and get those off your plate, and then deal with the tough stuff later. We've
talked about this before when I've been out here before. The frustration that I feel is that we have created a situation where we send people to Washington who really aren't interested in governing. They're interested in just winning.
They are,
and everything is a potential win and a potential loss. Who gets to the door first?
Right.
It seems to be a win. I won. I got to the door first kind of moment. So there aren't people who sit down. I mean, we had a rare moment a couple of weeks ago when the 20 senators got together.
Right.
That was rare.
Right.
That wasn't rare 30 years ago, 40 years ago, 50 years ago. It was pretty common.
That was, yes.
They come in. They don't really spend a lot of time with each other. They don't spend a lot of time together. And I think we all know that when you start spending time with someone, you and I spent a lot of time together last year.
Yeah, we have.
I know you way more than I knew you a year ago,
yes,
right?
Exactly.
So I understand you a lot better than I did a year ago. But if you and I only kind of knew each other from across the aisle and maybe even made a point of never really talking to each other, our relationship wouldn't be the same.
There's no
We'd
doubt.
probably never find out how much we had in common.
Right.
So so it's just not a scenario right now between the two parties, the two major parties, where they send people there who actually want to govern. They send people there who basically came from a legislative district that was designed for their party to win.
Yeah, exactly.
So they really not trying to appeal to the entire 535,000 citizens of a single congressional district. They're trying to appeal to a tiny little subset of primary voters for their party, which makes them really narrow, really specific in their thoughts and processes. And then the rest of us are going like, yeah, but okay, I don't feel as strongly, I don't feel that way, but that's who ends up representing us.
Yeah.
And so if you're a conservative individual living in a liberal part of the country, you just feel like nobody is going to listen to you ever. If you're a liberal individual living in Williams County, Ohio, you feel like nobody's ever going to listen to me.
Exactly.
When actually, if we really sat down and talked things through, we'd find out we had this tremendous amount in common.
Yeah.
It seems like we have to get to these crises moments. You know, like federal workers aren't going to go to work tomorrow, which for the federal workers kind of, quite honestly, turned in kind of a nice little 3-day holiday, right?
Yeah, yeah.
But it just, you know, if WBNO WQCT ran that way,
yeah,
I don't think the leadership in WBNO WQCT be around.
Yeah, they wouldn't
much longer.
No.
If the hospital ran that way, you know, if I was actually kind of sprinting up to the bank to put in the extra $20,000 to cover the payroll,
yeah,
I don't think I'd be around.
Yeah.
But in D.C., that's okay.
Yeah.
You can pass a bill that only keeps the government open for 3 more weeks, and everybody goes to the bar and celebrates.
Yeah.
So
feel like they've accomplished something. Yeah.
I am incredibly grateful for the constituency service and the response I get from Senator Portman's office, Congressman Latta's office, Senator Brown's office. It's just, you know, they can't accomplish for me what I need to be accomplished, and I don't understand why. I don't think it's really on them, those 3 in particular.
Right.
But, you know, I'm stuck, right?
Yeah. Yeah. We're all stuck.
Yeah. So accept what you cannot change, change what you can.
Yeah.
It's just that a lot of what influences the success of my hospital is in that I cannot change list.
Well, you know, one of the things that's frustrating to me, I'm an Obamacare customer.
Right.
You know, I'm a self-employed guy.
Right.
I'm one. Okay. My wife is just old enough to be on Medicare.
Yep.
So
You're
she doesn't have to
classic.
worry about it. So I'm that guy right
Yeah.
there. And it is a decent backstop.
Yeah, it sure is.
For, you know, the deductible's
Yeah.
ridiculous. Okay. At,
Yeah, it sure
you know,
is.
$6,500, $5,500, wherever it is right
what
now.
you're buying is catastrophic coverage. That's what you're buying.
Exactly. And I know that, and that's okay. That's
Right.
what I definitely need at this point in time for a guy like me. But the thing that really is upsetting at this point in time, too, is now all of a sudden I have been focused in on just one group of hospitals.
Sure.
You know?
Yeah, you can only buy one exchange plan in Williams County right now.
Yeah,
That's it.
It's over. Now I was told that I could come to your place if I had an emergency, and they said
emergencies.
get me to the hospital. Then they're going to take me to
Yeah.
Bryan. But if all of a sudden now I want to do something that is more planned and thought about,
you got to be really careful.
yeah, I've got to go someplace else. I've got to make sure I'm going to the right hospital. Yeah.
Got to make sure you're staying in the network.
Yeah.
And for some people around here, that's not us.
That's it exactly, and that's
so-
where I am right now, which is that's not good. I don't like that. It's unfortunate to have a
just
hospital
weird,
that's
isn't it?
trying to work with you and work with the area, and then the federal government tells you, well, you really need to have insurance, and I need to have insurance anyway, but you're not allowed to go to the people who would generally be your primary.
Well, the big
care.
insurance companies, but in your particular case, the big insurance company, what they're doing is they're telling the federal government that they have enough of a network and they don't need us.
Right.
But sure doesn't look that way for you, does it?
No, not at all.
And then you don't really have any choice to go find something else because the insurance companies kind of, quite honestly, I think they sit down and kind of carve up the country. Like, okay, how about you guys? You guys take Ohio, Michigan, Indiana, and then we'll take Kentucky, West Virginia, and Tennessee.
Yeah.
You know, but they don't really say that out loud.
Yeah.
So the market is just so bizarre. And I've said this. I probably said this every time I've been out here. If we didn't have a healthcare system, and we sat down today to design one, we would never, ever come up with what we have.
Isn't that amazing?
We'd come up with something else.
Yeah.
And so people say, okay, well, you're a proponent of single payer. I'm not necessarily a proponent of single payer. I'm a proponent of single payment. I don't understand why the hospital gets paid so differently by multiple different payers for the same service.
Right.
You know, when you look at when you look at utilities are sort of basically heavily regulated quasi governmental things. But the nice thing is from a utility standpoint, when you flip the light switch, the lights come on, and when you're cold, the gas comes on, and when you're hot, the air conditioning comes on. You know, as long as you paid your bill,
right,
and it works. But in our world, it doesn't work that way. And I don't know that healthcare should be that complicated. Yeah. Maybe I don't think it should be, but trying to change, the minute you announce what you want to change, you're going to upset somebody, right? You're going to announce something that the insurance companies are not going to like. You're going to announce something that the Democrats aren't going to like. You're going to announce something that the Republicans aren't going to like, and then it all just grinds to a halt.
Yeah.
So it's a bummer what you're going through. Absolutely a bummer what you're going through. But the Affordable Care Act did create for people something that they never had before, which was the option to, quite honestly, buy catastrophic coverage.
Yeah, and
you still spent a lot of money for it, but at least if you got really sick or really injured, you didn't end up in bankruptcy court.
Yeah, and that's what I had before Obamacare.
Yeah.
Okay. And it really was no. I mean, I've had this conversation. Really kind of funny because Tom Reed comes in here all the time. Tom's a big Democrat, and not real happy with the president and everything else. And he made the comment to me last week. Well, you can see how Trump screwed up the healthcare system right now, and everybody's losing their healthcare. And I said, well, reality is okay. It was coming this way before Trump, and I'm not a Trump fan, okay? But it was coming this way before Trump. Everybody said this is the way it's going to happen. My policy actually went down $50 a month.
Right.
My deductible pretty much stayed the same.
Right.
Okay. The only thing that really went south was now you can't go here, you have to go there.
Yeah. What you do in order to get those reductions.
Yeah.
You agree to less choice.
Exactly.
So the more choice you want, the more you're going to pay. The more choice you're willing not to have, the less you're going to pay.
And give me the extra. So, I'll throw the extra $50 in. Give me the old choices that I had before. But that option is off the table now too.
So the next time that you have Tom in, the fascinating thing that you should talk to Tom about is this very, very recent announcement between Amazon, Berkshire Hathaway, and J.P. Morgan.
Okay, all right.
And so now they're announcing that they're going to get into healthcare.
Oh wow! Okay.
Because between the three of them, they probably have north of 750,000 employees all over the world, and then all the dependents and everything else, and that really makes sense to me.
Yeah.
It just really, really makes sense to me, and I think if they're smart, and when you talk to Tom about it, he can give you perspective on that, because as soon as that was announced, one of the things that happened yesterday is the healthcare stocks all fell. All the classic healthcare stocks took a nosedive yesterday.
Okay.
And because you have a J.P. Morgan with plenty of cash, you have a Jeff Bezos with plenty of cash, you got a Warren Buffett with plenty of cash.
Sure.
So people were saying this morning on the radio, well, how are they going to do this? I said it's pretty easy actually. If you get really, really, really good at primary care, and you take care of kids right from the get-go the right way, and you get people to understand how their health matters in terms of their lifestyle and what they do, then the amount of money you're going to spend on the higher end care is going to start falling, and it will more than pay for itself. I mean, you'll still have the cancer, you'll still have the terrible things that happen, but you won't have the lifestyle related disease issues that are costing this country so much.
Yeah, no doubt. Phil Ennin, an hour goes by quicker with you than almost anybody else that comes in here, and it just always flies, and we appreciate your time.
Thanks for the sprint. It was fun.
No doubt about that. Come back and see us again, will you?
Yes, I will.
No doubt about that. The Medical Hour is brought to you, as always, by the Medical Specialty Clinics at the Bryan Hospital and Community Health Professionals. And that'll wrap it up again for another Wednesday. We'll be back again next Wednesday from 10 o'clock until 11, right here in the Q. Now back to Classic Hits on Q96.5 FM.
No sweat.